How are you today, students? Today start lecture number 1. It is therapy the mental disorders. The mental disorders, or the therapy of mental disorders, we differ two types. It is biological therapy and psychotherapy. Biological therapy of mental disorders, usually it is using psychotropic medicines for mental disorders treatment. For example, now you see on the picture, it is firstly, previous century, you see here the scientist Sakel. He was German physicians, German psychiatrist. In the 1933 years, he was use insulin because in this year was open insulin for treatment the diabetes. But the Sakel use the different drugs for that time to treatment the mental disorders. And he used insulin for treatment the patients with schizophrenia, with psychotic disorders. Insulin shock therapy, it is title of this therapy. It is methods of intensive biological therapy in psychiatry. Usually during this therapy, every day the person with psychotic symptom gets some dose of insulin, for example, 4, 8 doses every day. And then in one day, after some days, arise the hypovolemic coma. And during many psychiatrists considered in that time that this coma, another coma, atropine coma, for example, insulin coma, very effective for treatment these patients with schizophrenia, with hallucinations, with delusions. This therapy was used until the 1960 years, but by time, there are many investigations, and the science, psychiatric science decides that this method is not very effective. This method is danger, and in some cases arise death. And the many countries refuse in this time, for example, 96, 60 years previous time, refused from this method of therapy. For example, next methods of the therapy was used previous century, also open in the 1930 years. It is electroconvulsive therapy, was first introduced in the 1930 years and was very widespread in the treatment of mental disorders. Especially was very widespread in the 40s, 50 years previous year. It is psychiatric and neurological treatment in which epileptiform major seizures is arise. And usually it is artificial arising of the electric currents through the patient's brain to achieve a therapeutic effects. Usually the person with severe disorders, with severe depression, with hallucinations, delusions, get some course, for example, number 20, 30 of this electroconvulsive therapy. And then in some cases, really the patients achieve the recovery. Not effective recovering, but very good high remission. You see on the picture, it is on the above picture, you see one artist. It was a film, A Fly on the Caucasus. It is movie's title. He was suffering with psychopathy, and because he had very bad behavior, the psychiatrist used electroconvulsive therapy for treatment. But from 1950 years, previous century, was opened the first chlorpromazine. It is antipsychotic or neuroleptic drug. It was opened in the previous century and start the stage of antipsychotic therapy, and now we have these classifications. During these classifications, you see some groups, main groups. It is first group, very large group. It is antipsychotic drug or neuroleptic. The previous title was neuroleptic, now it is antipsychotic drugs. Then antidepressants or timoleptic drugs, another title. Then anxiolytics or tranquilizers or benzodiazepines. It is about third main groups. Then snowtropes, stimulants, normatives, anticonvulsants. It is classification of the psychotropic drugs by group. Так, main general qualities of psychotropic medicines. Main general qualities. The first qualities, for example, antipsychotic quality. It is quality indications or quality of this is reduce the psychotic symptoms. For example, hallucinations, delusions, excitation, very severe bad behavior, aggression maybe, dysphoria maybe. So antipsychotic, it is quality, which means reduce psychotic symptoms, reduce or decrease psychotic symptoms. Antidepressive or timoleptic qualities, it is due to the title, you understand that it is treatment, it is decrease depression and improving mood, for example. So it is antidepressive quality or effect recovering from depression. Anxiolytic effect, it is means founded from anxiety, you know, it is anxiety and anxiolytic. This quality means that the decrease anxiety, it is quality. Usually we use in the different phobias, fears, anxiety, and so on. Normotimic qualities, it is normotimia. Timia, it is usually means the mood, normo, it is normalize the mood balance. In these cases, usually in the bipolar affective disorders, we use these normotimics because the main qualities of normotimic, it is normalize the mood balance between mania and depression. Sedative qualities or sedative effect, it is decrease activity, it is relax, decrease very severe, maybe aggressive behavior, it is sedation, become relaxed. Next, hypnotic effect, for example, some drugs, they have hypnotic quality and arise they sleep. Nootrope effect, usually it is stimulation of activity of our brain, of the cover of our brain. And next, psychostimulant effect, it is now don't use, it is some drugs which stimulate mental and physical activity of the brain. And start from first group. First group, it is neuroleptics. Main qualities, it is indications and by effects. Neuroleptic has two groups. You see, it is typical antipsychotic medications and atypical antipsychotics. There are two groups. Typical antipsychotic medications show its effectiveness at the psychotic disorders treatment during 50 years, because I before said the first neuroleptic chlorpromazine was was opened in the previous century, in the 1982 year. But during many years, during more 50 years using the neuroleptics, we psychiatrists notice there are many serious side effects, and during treatment, different side effects, somatic, neurological. And during this year was many investigations to open a new drugs, for example, and appearance new group of antipsychotic medications having considerably small ability to cause extrapyramidal symptoms. And they get name atypical antipsychotics, atypical. Вот. There are new step in psychotic disorders treatment from open these neuroleptics because without extrapyramidal side effects. No, for example, you see the kinds, the title of the typical antipsychotic drugs and new atypical new kinds of the new atypical neuroleptics. Previously, till now, use haloperidol, stelazine, aminazine, aminazine, another name, title, chlorpromazine, tizercin, Sonapax. Till now, we use haloperidol, stelazine, for example, very popular in our country, aminazine, because it is not expensive drug and we use every time during different conditions. New kinds are typical risperidone, Zyprexa, olanzapine, Leponex, azaliptin. In our country, we use risperidone, Zyprexa, Leponex, for example. Azaliptin is known very long time. They have side effects too, but extrapyramidal effects not very serious than in comparison with typical. Так, indications of neuroleptics. Usually acute psychotic disorders, you remember from previous subject, from previous lecture, psychotic disorders which accompanies with hallucinations, with delusions, with severe excitation. This usually psychotic symptoms. Значит, first help, we can help to these patients with using of these drugs. Psychotic symptoms very often we observe not only schizophrenia, for example, second point, you see schizophrenia, psychotic symptoms, maybe you will study acute stress related, acute transient psychotic disorders, for example. To psychotic symptoms, it is only symptoms, and they may be in the different disease, for example, as a schizophrenia. Next, for example, delusion, maybe at the persistent delusional disorders. We have this group disorders, delusional disorders, which accompanies with delusions, maybe hallucination, but predominant delusions. Next, mania disorders, bipolar affective disorders, maybe schizoaffective disorders you will study after after some subjects. Schizoaffective disorders, the disorders which accompanies by schizophrenic symptoms and by affective disorders, mood disorders symptoms. Next, excitation. Neuroleptics we use the different kinds of excitation. It is severe behavioral disorders, maybe the mania, delusional excitation, maybe mania excitation, maybe psychomotor, maybe the delirium excitation, and so on. Catatonic, for example, excitation, and so on. Next, substance-induced disorders. Substance-induced disorders accompanies with maybe psychotic symptoms too. In some cases, maybe accompanies with very severe behavioral excitation or aggressive behavior, dysphoria, and we use here. Aggressive behavior. Aggressive behavior may be at the person with personality disorders and at the many above listed disorders. Hyperactive in the children, hyperactive behavior. Now, for example, we don't use very severe, like to the haloperidol drugs, we use Sonopax. Sonopax, it is mild, with mild influence, it is not large neuroleptics, it is small neuroleptics, and we use for treatment the children in some cases very severe behavior disorders. We use the small neuroleptics. No, usually this slide demonstrates that usually neuroleptics, a lot of cases we use in the treatment of schizophrenia and use now, for example, use as classical, typical and atypical antipsychotic drugs. Also, we use the neuroleptics in the treatment, the symptomatic and psychotic disorders, for example, it's the organic diseases. Куда я не знаю? Я не могу громко. Neuroleptics. Neuroleptics has by-effects, for example, somatic and neurological effects, by-effects. Somatic effects may be collapse, for example, from chlorpromazine, tizercin, they decrease blood pressure, and we get the clinical picture of collapse. And in these cases, we ask the patients to lie in the bed, to stay in the bed, especially after injection of chlorpromazine or tizercin, because somatic by-effects, it is decrease blood pressure, and these patients who stand up, go after injection, maybe fall down on the floor. Next, maybe allergic reaction. Allergic reactions, you understand, maybe different skin problems, maybe another allergic reactions of the skin, of the face, of the hands, and so on. Next, increasing weight. Very often when we use and prescribe neuroleptics, we see the increased mood or increased weight during if patients use the drugs very long time, for example, some months, and we observe the picture conditions when the patients increase weight. Next, hematological effects, disturbances of blood cells. Usually at the, in the many neuroleptics we observe, especially at the azaleptin, we see the blood cells disturbances, for example, decrease number of leukocytes, maybe disturbances of erythrocytes, and so on. It may be the somatic effects. Next, intestinal problems, intestinal vomiting, diarrhea, for example, nausea in some patients, maybe. Skin and eye effects, for example, can arise during Sonopax. Neuroleptics, it is retinopathia. Next, anticholinergic effects, dry mouth, maybe constipations. Next, by-effects neurological. For example, we can observe epileptic attacks or seizures, epileptic seizures. Then by time, during long time, during very long duration of using the neuroleptics, we observe pseudo-Parkinson syndrome. То есть we see tremor, rising of tremor, bradykinesia, maybe dystonia, and so on. Then arise dyskinesia, dystonia, agitation, maybe rise. And it is extrapyramidal effects, and they may be, in some cases, may be increasing and may be danger for the health of the patients. Atypical antipsychotic adventures, atypical, it is low risk of extrapyramidal side effects development, then an ability to reduce secondary and possibly primary negative symptoms as well, an ability to reduce cognitive breaches intensity, an ability to reduce comorbid affective symptomology, absence or low level of hyperprolactinemia, effectiveness in cases of resistance to traditional neuroleptics. For example, in some cases, we postpone from classical neuroleptics to the atypical neuroleptics, and we get good effects. Next, relapses of disease are being marked more seldom. Next group, it is antidepressants. It is main qualities, it is indications, complications, and by effects. Types, there are many types, groups. For example, for students, we give two groups. It is tricyclic groups and serotonin selective reuptake inhibitors. For example, types tricyclic antidepressants, it is amitriptyline, clomipramine, imipramine. Serotonin selective reuptake inhibitors, usually in our country, in your country, we use fluoxetine, Prozac, sertraline or Zalof, paroxetine or Paxil. This group, second group, more modern group, it is usually used in many countries. Last 10 years, more 10 in this century, more effective. The advantages of this group, next, for example, minimized spectrum of side effects, safety and tolerance, especially important in the conditions of therapy's prolonged course, absence of individual dosages, titration, and simplicity of dose and compatibility with practically all groups of medicaments. Indications, any kinds of depressions you remember from etiology, for example, maybe endogenous, exogenous, psychogenous factors, and there are all maybe depression from endogenous factors. It is hereditary, bipolar, for example, affective disorder, bipolar affective disorder. Exogenous factors maybe after result of any trauma, maybe after infection, after intoxication, maybe, for example, after drug abuse, and psychogenous very often in many countries now, there are many different natural, not natural, technical, different problems, accidents, and after death relatives can arise this depression, this psychogenic depression. This all kinds of depression. Next group, somatoform disorders. After some classes, you will study somatoform disorders. Now I say somatoform like to somatic disorders, but it is not somatic disorders. Somatic disorders, they have organic origin. So they have origin, for example, different maybe flu infection, bacterium, virus, so on, injuries, maybe stones in the kidneys and so on. It is somatic disorders. Somatoform disorders, they like by clinical pictures, they like to the somatic disorders only due to the complaints and clinical picture. But after investigation, result of investigations, we don't get any pathology from internal organs. Next group, when the indication, it is drug abuse. Drug abuse, very large group, alcohol abuse, heroin abuse, and so on, which accompanies different complications in the organs, kidneys, heart, and so on, and and accompanies by decrease of mood. In these cases, we can use in the withdrawal state, we can use antidepressants. Next, very effective this group, second group of antidepressants in the treatment of obsessive and compulsive disorders. If you remember obsessions, different kinds of obsessions, doubts, thoughts, remember cleaning, washing, that is compulsive, different compulsive actions, very effective antidepressants, usually Zoloft. Next, panic disorder, eating disorders. Panic disorders, it is attacks of anxiety attacks. Panic disorders with different level, high level of anxiety. In these cases, very effective benzodiazepines and antidepressants. Usually a combination of two drugs, very effective for this treatment. Eating disorders, you remember the pictures of eating disorders, nervous anorexia, bulimia, antidepressants used too. Disorders of sleep, for example, there are many problems. Person if has bad mood, maybe problems with sleep, connected with sleep problems, and we use antidepressants. So during conversation, we must find etiology of the decreased depression. Next, for treatment, the enuresis in the children. In our countries, we traditionally we use, for example, the previous tricyclic we use amitriptyline. They have by effect, it is stop the expression of water, and we treat by this by effect the enuresis in the children. Usually duration, the classic depression treatment, it is 3 months, 6, 9, and 12 months. It is depends, and more, maybe 2 years, maybe 3 years. It is depends from severity of the depression. During treatment of depression, don't arise the dependent syndrome. You must remember, don't arise dependent syndrome. Principles of treatment. Principles of treatment by antidepressants, it is estimate the level of depression and etiology, character of depression, primary or secondary arising, it is depression primary or secondary. For example, maybe depression arises after delusion. То есть the schizophrenia maybe, firstly, maybe arising hallucination or delusion, or secondary arise depression. In these cases, we use combination, for example, neuroleptics and antidepressants. Next, taking into account the individual features, we must take into account the age, gender, weight, sensibility, current somatic or neurological conditions, and dynamic observations, because it's very, for example, if person is older, maybe 60 years, has delusional disorder, organic, it is very, we use very mild dose, small doses, or maybe use only small antidepressant, not small, we use very little dose of antidepressants. Side effects may be anticholinergic, may be central, for example, disorientation, delirium, agitation, usually can arise at the large dose and the older patients. Sedative may be effect, depends from drug. For example, amitriptyline can arise fatigue, decrease energy, hypersomnia. For example, another second group maybe stimulate, for example, paroxetine and so on. And we prescribe these drugs, serotonin reuptake drugs in the morning. And neurological. Next group, anxiolytics. You know this, maybe observe in your life, alprazolam, clonazepam, diazepam, and so on. We use every day in our practice in other field of the medicines. Qualities of the anxiolytic. They have 4 types of effects. Anxiolytic effects, it is decrease the level of high anxiety, sedative or hypnotic effect, relax muscle, and anticonvulsant quality. Indications. Usually anxiety and phobias. Different, you remember obsessive fears, name phobias, emotional tension, panic disorders, somatoform disorders, obsessive compulsive disorders of sleep, epilepsy, dysphoria, and drug abuse. То есть very, very large group. Side effect may be allergic reaction, decreased concentration, attention, sleepiness, mild forgetfulness, maybe antegrade memory disorder, not severe, during the therapy, agitation, withdrawal syndrome. You must remember complication, you must remember formation dependent syndrome. Only 2 anxiolytics can arise dependent syndrome. And because we treat by anxiolytics only 2 months. Next, normotimics, kinds, lithium, valproates, phenylipsin or carbamazepine, clonazepam. Qualities, supporting or regulating the normal level of mood, don't allow to increase or decrease mood. Before I said that this normotimics safe balance between depression and between manic. Not allow go to the depression and not allow goes to the mania. And if person take every day regular take these drugs, his mood stay in normal. Now you see indication it is bipolar affective disorders. Nootropes I don't talk very much because now nootropes don't use very effective because due to the medicine it is have not founded, is not. But you must know there are many nootropes group, piracetam, encefabol, pyriditol, panocalcin, phenibut, neofen, and so on. Usually it is qualities improve metabolism of issues of the brain, improve cognitive function, memory, attention, and so on. То есть improving cognitive functions. Indications, after head trauma, vascular disorders, mental retardation, cognitive disorders, and so on. But duration treatment must be 2, 3, 4 months without any complications. Next, last, concept of placebo effect. You must know there are negative and positive placebo effect because you must know action of medicines include pharmacological action and psychotherapeutic effect. For example, psychological action. Pharmacological effect may be minimal, may be absent, but patient can feel well. It is phenomenon of placebo effect. Placebo effect presents don't only at the medicine taking, it presents at the physiotherapeutic procedures, for example, acupuncture, ultra high frequency, and other. Positive placebo effect. Medicine have other sizes, colors from usual. Patient consider and perceive the unusual and more effective. When doctor is famous, when deficit of medicine present, when constant advertisement about medicines by TV set, for example, expensive price of medicine. It is factors which increase positive effect. Decrease positive effect and rise negative placebo effect. It usual form, color, sizes of the drugs, low price, and patient does not believe and trust to the doctor. You must know legal and ethical aspects of psychiatry. For example, in many countries present the law about psychiatric help and guarantees the rights of citizens. Maybe in your country you have another law, another title, but usually in the every law we have information about rights of patients. Ethical aspects, we must take into account ethical aspects, and due to this law, only free cases when we don't take into account the rights of the patients and can admit the patients to the hospital. For example, aggressive behavior, conditions of hopelessness, and conditions when person cannot stay alone without observation, severe depression, maybe mental retardation, and so on. Так, we finish this fifth lecture. Goodbye.